on now to the second session on this high-risk live donors, which is on obese donors. And Dr. Prabhu Kanchi unfortunately couldn't make it here, but has been kind enough to come online and will give his talk on obese donors, 10 minutes, and discussion will be at the end. So hopefully we'll be able to have, no technical glitch, and he will come online. Meanwhile, we will have to have another session for you for Doppler. Right. Welcome, Dr. Prabhu. Sound.
Am I audible, sir?
Just now. Dr. Prabhu Kanchi is from Kaveri Medical Center, Chennai. Yes, we are able to hear you.
Thank you for the wonderful opportunity. Today we'll be discussing about obesity in donors. To start with, we'll discuss about the recent KDIGO guidelines. We'll discuss about the definition and statistics of obesity and how obesity causes CKD, and we'll see how donor obesity has long-term outcomes in the donor. We'll also see how donor obesity affects the graft function. So we'll discuss about the basic bariatric indications, benefit of bariatrics, and it's some of the renal.
We are not, the sound system is a little.
Is it okay now?
Okay.
Can I go?
You haven't shared your PPT. Can somebody guide him? Yeah.
Can you see it now?
No, you haven't shared it. Yeah, okay, fine. Make it full screen. Full screen nahi hai. I think till we have technical issues, the chairperson can take over some aspects of donor obesity. Comments from how you all do it.
Redonation laparoscopy custody for 10 years. 18 patients have come in.
Yeah. Speak inside the mic. Yeah. Into the mic. No, I think it is on.
See, a decade back, the thinking was that the donor should be completely normal. So the no risk donor. That has become a less risky donor now. Now we have discussing about a topic called high risk donors. Is it acceptable to all of us? Because the obesity, presence of diabetes, presence of hypertension in these donors, they have got a long-term effects on the donor. So if you look at the data, now it is on.
Yeah. Prabhu, can you? Yeah, please go ahead.
Recent KDIGO guidelines. KDIGO already mentioned that 3 suggestions. It said the obesity to be
The sound system is a problem. On his end.
Can you hear me?
Prabhu, can you talk without slides?
Okay, so KDIGO has a 3
Your
suggestions.
opinion.
own camera.
I think we can continue to have comments till he comes up with.
You can off your camera. You can off your camera and then you can go ahead. Then voice would be clear.
Camera off.
Prabhu, you can make your camera off and then you can go ahead. It might have the better.
Any of the chairperson wants to comment on it or from the audience?
Grouping of issues. So we have had donors where the BMI was high, but the
Mike, please.
it's switching off repeatedly.
Yeah, yeah.
Suppose the patient has a BMI of 34 and you say that that's one thing, because my belief is that they will invariably go back to their previous.
We have. What's happening to the mic?
So should we encourage that? Will you accept such a donor who actually reduces by dieting or whatever and the BMI came down and now the BMI is 28? Should we accept the donor? Dr. Santosh. What?
I would say, yeah. I would say.
No, we usually accept the donors, those who are compliant to your advice and getting.
Especially since they've shown some degree of commitment, but I think they require a lot of reinforcement, especially mothers. They tend to put on weight. We find they need a lot of reinforcement to continue to maintain that weight.
थोड़े से देना है थोड़ा माइक से नहीं स्टैंड ही है दूसरे माइक नहीं
Yeah, so my concern is no, because there is the obesity, there are two concerns. One is the perioperative risk. That will be taken care of by reducing the BMI, but would higher. Suppose it's borderline and they reduce weight, but post donation they tend to go back to their. So, and we know that the long-term impact is there from obesity as well with regard to. So, by reducing the weight, I believe the perioperative risk is probably taken care of, but the long-term risk, I believe, still remains. I'm not saying that we should, but I think there is a concern there.
So would you not take obese with
As of now, we take only if BMI is less than 30, otherwise we
less than
don't.
30?
I think it's clearly a social decision, not a medical decision. Medically, nobody would approve a person who could get in trouble. We are all doing it as a social decision.
Those donors.
You mean in the absence of another donor, you are doing it?
Sir, if Prabhu is ready, then we
So
can-
what would be the ethics of sleeve gastrectomy followed by taking the donor after loss of weight?
I have done it.
What-
Yeah.
When they come to donate, when they come to donate with higher BMI, you don't tell them, you go get a sleeve gastrectomy done and then come, because you are subjecting the voluntary live donor to a major procedure which may not be for her own benefit at that time. So that is the ethical issue. But on the contrary, if an obese person has had a sleeve gastrectomy before and come with a reduced weight, you are justified in taking it. And of late, there are very good medications for obesity. And so I think if somebody is ready to reduce the weight and has reduced the weight, we must take that person as a donor.
We have done 18 sleeve gastrectomies for pre-donation. Those people who are a BMI for more than 35, in last 10 years, we subjected to sleeve gastrectomy 18 patients, and weight loss was around 22 kg in next 5 months. BMI came down for average from mean of 40 to 30. and pre-transplant donation, 3 diabetes became independent, no diabetes, high blood pressure came down, no side effects of any drug. We don't see nephrolithiasis in the sleeve gastrectomy, but interstitial bypass. So avoid interstitial bypass. So far, we have done 18 and accepted donation 16. 2 patient recipient died before taking the patient for a donation. So
Vivek,
pre-transplant donation, the sleeve
Vivek,
gastrectomy is fairly safe.
Vivek, this paper was presented in the southern chapter
Yes, it's my
about
mind
2
only.
or 3 months back. The question which was raised was, is it ethical to subject a donor to a major surgery which is not for that person's benefit?
Even donate kidney is not for his benefit.
No, that is different.
That's not different.
You know, it is
Donation
different.
is not for his
No,
benefit.
they accept.
It's only emotional.
No, let all of them decide.
Correct.
The donation surgery definitely is a risk, but they understand it
Dr.
and
Sena,
come for
But
that.
even morbid obesity also has a risk of future diabetes, hypertension,
go for the next top.
that also,
Then
even
back
malignancies.
again.
Yeah, I think after the.
Should
Sir, over-
BMI be the criteria? That's a big question because we know well waist hip ratio and other parameters are more important than just considering BMI. Just because somebody is come down to less than 30, I'll pass him as a donor. Is it?
See, that's the
See,
latest,
most of the
BMI
most of the
and
patients who come back to the original weight after the surgery, it happens in about 80 to 90% of these
Doesn't
donors.
happen.
So it is whatever you do it before transplant.
And
So
Subbarao,
risk is always there. Risk is
let me
always
see.
there.
Sleeve gastrectomy was not discovered for donation. It was discovered or it was done for last 30 years to reduce the side effects of obesity in the long run, not for donation primarily.
Sir, healthy obesity can be there. Any obese patient can have the normal glycemia, no any intolerance
Yes,
to
yes.
normal BP. If everything is fine, and then taking these patients as a donor and those who are compliant to reduce the weight, obesity does not mean that this patient has every metabolic syndrome signs and symptoms. So
when
those
you
who do not have, we can take if they are.
So I
What
think there
is
is
your
going to be a,
cut-off line?
I think there is a fat chance that we will miss dinner if we keep talking of obesity.
So
It will be
Dr.
very
Khanna would be responsible for this.
Yeah, thank you.